I think we'll go ahead and get started. Thank you for joining the Education and Awareness Breakout session. My name is Savannah Phelan Jones. My pronouns are she, her, and I'm the Training and Volunteer Coordinator for the Alliance for Suicide Prevention of Larimer County. I will be your moderator for the portion of this event. At this time, all participants are in a listen-only mode. Please keep your mic muted for the duration of the session. Questions can be submitted through the chat feature throughout the session. We do encourage participation. Please note that this session is being recorded. Feel free to privately chat me in the chat box if you need any assistance technologically or otherwise. We also have emotional support in each room. Should you need emotional assistance, look for the person named support and send them a private message, and that will be mainly in the main room if you can't find them in others. Thank you for joining us today. I will now turn it over to our presenter, Kimberly Pratt.
Thank you, Sav. I'm so excited to be here today, you guys. My heart is just in suicide prevention. So I am Kimberly Pratt. I use she, her pronouns. I work for North Range Behavioral Health over in Weld County, and I'm the coordinator of the Imagine Zero Weld County Coalition, as well as the Regional Youth Suicide Prevention Coordinator in Weld County, and the project coordinator for suicide education and support services. And so our work overlaps a lot with Larimer County. I'm also a master QPR trainer, so I have trained the vast majority of our Larimer County QPR trainers, which is super awesome to watch them go out and make the training their own. And that part of that is why I was asked to speak on education and awareness for all of you today. It was so great. Thank you for your comments in the chat. I'm really excited to talk about this pillar and then how this can be embedded into all of the work that you are all doing. So to get started, let me click for you. So the education and awareness goal, the pillar goal is really that we implement education and awareness efforts for community members, providers, and professionals so that we can increase their knowledge, skills, beliefs, and attitudes about suicide. And we believe that by doing that, we can lessen the suicide attempts and deaths. So when we're talking about this pillar, there's really three main, I was gonna say pillars for the pillar, but that's not accurate language, but I know that you're all with me and can work with that. So the first thing that we're gonna talk about is gatekeeper trainings within the pillar. So a gatekeeper is anybody, clinical, not clinical, who is trained in suicide prevention. It's anybody who can recognize somebody in a crisis and know what to do and how to connect that person to care. So one of the things, sorry guys, I clicked too soon. So one of the things that we want to do with the gatekeeper portion of this pillar is train 50% of a certain population. And we're going to pick 3 of populations to prioritize in the first little bit. So you'll notice that we have a list on this slide, and these are really those priority populations that we're concerned with. And the Alliance for Suicide Prevention and Imagine Zero Larimer decided to focus on those ones that are highlighted in blue at the bottom of the slide to really start there, because we do have connections and we are embedded with those organizations. Now, I want to be clear, we're going to train as many people in as many places as possible, and we will train anybody, anytime, anywhere. And we are going to start out by focusing with the faith, the veteran, and the LGBTQ plus communities for our gatekeeper trainings. And the goal is to train 50% of all of the people in all of those organizations, which is a pretty big goal if you think about it. The other thing that we're going to do for education and awareness is talk about social media campaigns. So the goal with this part of the pillar is to embed social media campaigns throughout our community to reach 75% of the priority population. So some of those campaigns are Man Therapy, Let's Talk Colorado, Below the Surface, and the Be There campaign with the VA. So very quickly, I'm not going to spend too much time on this because we're going to provide all of this information in the follow-up anyways. But I just wanted to show you one of my favorite campaigns really quickly, how easy it is to access any one of these campaigns. So if you just Google Below the Surface or Man Therapy, really any one of them, it'll take you right here to all the different campaigns. Below the Surface was a campaign that was created by teenagers for teenagers in the state of Colorado. So they went out and they said, hey, teens, tell us what you want instead of us telling you what you want. And so we have teens put together their videos. I love, love, love this. So here is a fun fact for you. So if you have a crisis number on your phone, you are 60% more likely to use that number if you're in crisis just by having it on your phone. If you practice using a crisis number, so you practice texting the hotline, you're 85% more likely to use it if you're in crisis. And that was a study done by our own Attorney General based off of state Patel. So with Below the Surface, what they did is they show you what happens if you text the hotline so that teenagers can get familiar with that. And so I just love it. I also wanted to let you guys know that if you put any one of these campaigns right here on the bottom, you can put any one of them in the Google search and put Toolkit after the name. So Let's Talk Colorado Toolkit or Below the Surface Toolkit. And you're going to get a ton of collaterals, deliverables, stuff that you can post on your social media pages, on your company website. And this is just one way that you can help. This is, I saw there's some people from Poudre School District. You can get your kids, your students involved this way by having them Google their favorite campaigns and find things that they can post on social media. And there's tons of things out there and they're all free. So one of the goals, again, of the education and awareness pillar is to get these suicide prevention campaigns out to our community, especially our priority population. So we want to get people gatekeeper trained. We want to share our social media campaign. And then the third chunk of this pillar is to help make training sustainable. And to do that, what we are really encouraging and what one of our goals is within the pillar is to create policy and procedure around gatekeeper training. So staff might, work at a company and say, guys, we have to get everybody trained in QPR. And they're going to be like, cool, you take that on, you do it, awesome. But what happens if Sav leaves for a different job? What happens if she moves, right? So the reason we want to develop policy and procedure around training is so that we can make sure that it's sustainable. And this is one of the ways that you can help us, is to not just be a champion for the training, but be a champion for the policy within your organizations. Okay, so that was really the short and the sweet of what we're looking to do with the education and awareness pillar. I want to talk a little bit about what's already happening in Larimer County. And this is not all inclusive. These are just the really major big ones. I know, as we saw, that there's people in Lions doing trainings, that there are people in their own organizations doing trainings. And if you have trainings that are going on that maybe the Alliance for Suicide Prevention isn't aware of, please share that information with us. That helps us, because as Sarah said at the very beginning of this is all encompassing. This is community collaboration. This is collective impact. So if you are doing work out there for suicide prevention, please tell us, because we want to help support that work. Right now, all of the organizations that you see on the slide are offering trainings for suicide prevention in one capacity or another. Most of these organizations have QPR trainers and they offer QPR training. So QPR, for anybody who doesn't know, let me slow down. It is the most popular gatekeeper suicide prevention training in the United States. It is also the suicide prevention training offered and recommended by the Office of Suicide Prevention here in Colorado. And so all of these organizations are offering QPR, again, and that stands for question, persuade, refer, and they have trainers. And Sav just put in the chat, if you're interested in QPR training, email her QPR. I love, love, love QPR. It is 60 to 90 minutes. It holds the same weight as a CPR certification. This is something you can put on your resume. It offers continuing education units, and it is a nationally registered best practice. So it's pretty great. Okay, so I'm gonna black the screen out really quick. So I don't want anybody to be like, oh, the slides are gone. Just hold on tight, all right? So I'm going to do a quick little recap. So we, in the education and awareness pillar, want to get gatekeeper trainings into our community. We want to get social media campaigns into our community, and we want to develop policy and procedure, right? So here's what we want to do, but why we want to do it, I think, is more important than what we want to do. So I'm going to put up the next slide, and I'm going to give you an opportunity to read the little cartoon that I have there for you, and then the question. And I'm going to sit back silently for a minute, which is going to feel like a really long, awkward pause. But I want you guys to be able to really read that cartoon and think about the question. And then if you would please respond in the chat, I would really appreciate it. And then we'll discuss the things that you put in the chat, okay? Julie, this is being recorded. So again, for anybody who just came in, I'm asking you to look at the cartoon and then respond to the question on the slide in the chat. Thank you, Jonaki. I think I said that. Thank you for sharing that. I recognize the vulnerability it takes to share that openly, and I appreciate that share. Definitely a lot of stigma from the Latinx community. Yes, and the just deal with it. Thank you, Mitch. Oh, I saw that John said something. You guys are typing too fast. Yep, there's a huge need to follow up and connect. Thank you. Oh, I love this image. Okay, thank you for saying that, Kaylee. One of the things that you guys can Google if you want to maybe replicate this conversation in like your classrooms or in your companies or wherever on social media, if you just Google physical pain versus emotional pain or physical illness versus mental illness, you can find a couple different cartoons, which are really, really like, and I think they're great teaching tools. Yes, I see this a lot. People are afraid to take suicide prevention classes because they think it's going to hurt too much or be too hard. Just the lack of compassion around mental illness. Whenever I'm teaching a QPR, one of the things that I always ask people or tell people is that one of my goals in teaching anything about mental health is that my hope is to teach people to treat emotional pain with the same urgency, care, and compassion as physical pain, because it certainly deserves all of those things. I'm going to read through the comments a little bit more and then we'll keep discussing them. It is hard for people to talk honestly and openly. Certainly, you know, it's interesting because we're all sitting here in this session, and I think that you attend sessions and conferences and symposiums like this because you are one of those community champions. Every now and then we get somebody who wants to learn for the first time. But the reason why education and awareness is so important, and thank you so much, you guys, for your participation. I love these comments. Sab, feel free to jump in if I missed something important. But all of these comments, this is why this pillar is so important. This is why this pillar matters so much. So what we know, first off, is that more people are impacted by mental health than we think. And when I say we, I mean the general population. And so many people are not aware that this is our neighbors, this is our family, this is the people we work with, right? The CDC reports that 1 in 4 people has a diagnosable mental illness. Now that's people, right? That doesn't necessarily mean a mental struggle or mental difficulties. We know that mental health impacts people. And this is going to lead us to the second bullet point on this slide, which is the more information and awareness we have, the more easy it is to change the script, right? So when we're talking more and more about mental health, when we're asking our businesses who are not mental health focused to have conversations, Marshall Spring is doing the means restriction pillar, and they're doing a QPR training for Liberty Firearms, and it took him months to get into that place because they're like, what do we need to know about suicide prevention, right? But the more we talk about it, the more it allows us to change the script, which is important because our next bullet point is we can reduce stigma. The more we talk about it, the more we can eliminate that stigma. And when we eliminate stigma, we're able to connect people to treatment more easily. And treatment is crucial for people to heal. There's this sample. I want to share a very quick story with you, and then we'll talk about some of the resources and how you guys can get involved and then do some questions. But so the Golden Gate Bridge is one of the most popular places in the United States for people to die from suicide. And recently, when I say recently, it's in the last 3 to 5 years, they finally approved a safety barrier for the bridge. But it took years and years and years of advocacy and conversations before it was approved. And one of the women who was on the board of directors for the Golden Gate Bridge said, I never approved or I never passed the safety barrier because in my mind, I thought, well, if they don't kill themselves on the bridge, they're just going to go somewhere else and kill themselves. And what we know, what research tells us is that when we can reduce access to means, we can reduce suicide attempts. And so it took education, it took awareness of this fact for them to pass this bill. And now the Golden Gate Bridge is going to have a safety barrier built on it, which is super awesome. So again, education and awareness is crucial for our communities. Okay. So we need your help. This is a community-wide effort, especially education and awareness. So different ways that you can help is set up a training. Sav is sitting here right now with her beautiful face, and she's in that chat, and she is ready to do a training for you. I was going to say today, not today. We're pretty busy today, but tomorrow. Send her an email. You can email me, even though I'm in Weld County. I work very closely with Larimer County. I will get you connected to a trainer. So this might not be a training in your workplace. That might be too big of an ask or too difficult of an ask, but you can get yourself trained. We will train one person. We'll train you and a group of friends. Get a group of friends together next week and we will do a training for you. Another way that you can, and I wanted to point out really quick because we did have a lot of Poudre School District folks on here. One of the things that we know with young people is that the biggest protective factor for them is a trusted adult. And that oftentimes young people don't go to adults because adults don't know how to respond, no fault of their own. But one of the best things that we can do to support our young people is to train the adults that they turn to. So even though these trainings isn't specific, ASP does have trainings for teens, and getting our adults trained is just as important. The other thing is to join the Imagine Zero Coalition or one of the work groups for one of the pillars, and Rachel shared that information earlier, and all of that will be provided in the next steps thing so that you can figure out how to join either the coalition as a whole or an individual work group. Help us by sharing out social media campaigns. If you need a list of those, if you aren't sure where to go, email myself or Savannah and we will help you share them out. And then again, if you do happen to have those that foot in the door at your organization, please help us get a QPR training or help us have conversations with somebody that we can write policy and procedure that would make gatekeeper training part of the culture. And then finally, help us get connected to community champions. So you'll see that list there on the slide. Again, the ones highlighted in blue is just where we're starting, but we will talk to anybody and work with anybody. So please, please, if you have a community champion, if you have somebody who is like super excited about education awareness, get us connected to them so that we can start working on this stuff together. Okay, and I just want to give you some resources. These are absolutely not all of the resources in Larimer County, but these are really the big ones that we want to make sure everybody is aware of. If you remember at the beginning, I said if you have crisis numbers in your phone, you're 60% more likely to use them. I would encourage you all to take a screenshot of this slide if you don't know these resources already. If you have never texted or called a hotline before, I'm going to encourage you to do that today at some point. See what happens when you call or text. Tell them I'm just testing this out, and they're going to say, awesome, thank you for doing that. Do you have any questions? And by doing that, you're 85% more likely to use those services if you or somebody you know is in crisis. Okay, whew, 20 minutes in and out, folks. So here's my contact information. Here's Savannah's contact information. Please take a screen or a picture of this screen. And for the next 10 minutes, we're going to open it up for questions. I see that we have 27 new messages in the chat. So I'll try to get through those and see or have Sav help me answer some of these questions.
Yeah, so just hopping in, Kim, thank you so much for presenting that to us and sharing with us that information. Mostly what is in the chat is just great, great input from attendees about, you know, responding to that comic of yours, talking about stigma, talking about where it's appropriate, what people feel like it's appropriate to talk about mental health, where. And then one new message that we got from, and I believe they told us how to pronounce it, Janakai. They mentioned 988. So do you want to speak to us about that briefly, please?
Yeah, so I want to say, okay, whoever's in charge passed 988. So 988 has just been approved. Right now, the National Suicide Hotline is 1-800-273-TALK or 8255. And there has been legislation on the table for a few years trying to get that number turned into 988. Just like we have 911, they wanted a quick and easy phone number that people could memorize and not have to try to memorize that big, long 1-800 number. So 988 was just passed by the FCC. And right now, the biggest concern with that, really the only concern with that, is funding. Right now, there is no funding. So even though it has been approved to use the 988 number, first off, that number will not go into practice for at least 2 years. So people calling it right now, there's nobody answering that phone number. We need funding for that phone number. This is something that Sarah Brummett at the Office of Suicide Prevention, as well as many other state suicide prevention offices are working on, is to now pass legislation that will get funding for that. The 1-800-273-TALK number also is not funded. So all of that is privately funded. It's not federally funded. And so that is, you know what, I said that. And as soon as I said that, I feel like I'm not 100% sure about that. So we'll fact check that. But I know that funding is an issue. But 988 is passed. And if we can get funding, I think it will be a fantastic resource. Right now, we have the first step, and that's awesome.
Thank you, Kimberly. And then Kaylee popped into the chat and just let us know that she volunteers for the crisis line, which is a great resource. We use that all the time. So just to reiterate, it's a text and call line, but text, you can text HOME, HOME, to 741-741. And that number is fantastic. It's very easy to memorize. In our youth education, we make the kiddos repeat it. So we just go 741, 741. And so
I saw that, Dar. Thank you for clarifying for me, you guys, that there is federal funding for the Lifeline. Thank you for that clarification. I apologize for that miscommunication. And yes, you can text the word start, you can text the word home, you can text a blank bubble and it will pop up. So we don't ever want anybody to feel like they don't have the right key phrase. These are just things that kind of help give people a little bit of direction, and that helps them get connected.
Awesome. Well, thank you so much, Kimberly Pratt, for presenting and speaking with us today to continue the conversation around education and awareness. If you're interested in receiving trainings, like Kim said, please contact myself. Rachel popped in previously, Rachel Olson from the Imagine Zero. She's our Imagine Zero coordinator. And she put a link to the Get Involved doc, which I reiterated is on our website. So that's the website that folks are clicking on to join these breakout sessions. It's on that same page. So that doc, if folks are interested in looking at it, kind of reiterates how can you get involved, connect with a trainer, receive a training, join a work group to continue the conversation around whatever it be. I run a Larimer County trainings work group that is meeting actually today. If anyone provides trainings to the community in Larimer County and wants to be a part of that group, please shoot me an email. I can send my email to the chat again, and I would love to hear from you all. I'm going to put a link in the chat box, which is a post survey that we would all super appreciate if you could fill that out for us at the end of the event. We're grant funded, so that helps us out in that way, and also will give us any feedback so that next time we run a virtual event like this, we can have it go smoother if possible. Thank you for attending this session. Please refer to the ASP website for information on closing statements and following sessions. And I'm going to pop that link in the chat for the follow-up survey. And thank you again, Kim, so much for presenting. We do have a couple more minutes, so if anyone has any last questions, Kim and myself will stay on for a little while here, so please pop your thoughts in the chat and we can go from there. So thank you again so much, Kim.
Yep, thank you. Thanks to everybody for being here.
So I'm just gonna pop on here really quick. Andy Jason just said that they are the program director for a peer education program where high school teen volunteers do presentations in middle schools and high schools about teen depression and suicide prevention. That is awesome. So Andy and everyone listening, ASP provides schools, middle and high schools in Larimer County with youth education, and they do talk about what depression looks like for teens and obviously suicide prevention as a whole. I'd love to follow up with you and see if we can connect, and I'd love to see what that looks like for your volunteers. That's really cool. And just to reiterate, now that we're done, if no one else has any questions, feel free to return to the main page session. And I just popped that, let's see. I'm just gonna pop this post-survey chat here. So we'd like for you to fill that out at the end of the event if you can. Feel free to go back to the main page and there will be some closing words. And we so appreciate, again, everyone joining us. And thank you again, Kim. A million thanks. Appreciate you.